Hey guys and gals, Dr. Pete Stover here. I want to show you a case that recently we completed. This patient came up to me and he's wearing an Ossix flipper, and he said, I got my tooth knocked out many years ago, and I've been told I can't get an implant. I don't have enough bone, and what do you think? Can we place an implant? I said, well, we need to get a 3D because what we see two-dimensionally can definitely skew our perception of what's going on. So I had him come in, we took a 3D, and now you can kind of see here what I'm talking about. He definitely has a buccal deficiency, and so we took a 3D, and what I found was I had room to put a 4mm by 13mm implant. And I was like, yeah, we can work with this. So here I am, I'm using my surgical guide to mark the palatal aspect of my flap, and told him, I said, we'll place the implant. I did some grafting to help build up that, but I'm not going to bore you with the flap, but one of the things that you really want to pay attention to is the guide will tell you where to put the palatal aspect of your flap. And so here it is. So we made our flap. We're getting ready to use our PilotPlus drills. It starts with 6mm, and so this guy has sleep apnea and does not breathe through his nose. So we're trying to not drown him. I told him, I was like, the worst part's being waterboarded. And so anyways, we start drilling the pilot hole, and we get the 6mm down, and the space is real tight. I'm kind of fighting. I'm trying to keep my big fat hands out of the way so the camera can see, and we're wrestling. And something I actually posted very recently on a Facebook group was, hey, if you're fighting for space, especially with these anterior guided implants, use a drill extender. And so here in a second, you're going to see that we kind of, instead of fighting this, and oh, by the way, these drills are aggressive. You're not wanting to, this is not a just drop it and hold and push hard. It's, let the flutes cut, let them clear. But if you look here, we have a drill extender on. And so now we're not wrestling with this at all. We can get this thing seated, no problem. So we did the 6mm. We're going to come back in here in a second. We're going to do the 8. So with PilotPlus, we literally have a triple tapered drill system. And so it's a literally 6mm, 8mm, 11.5. And so we're going to get this to depth. And again, you can see how tight that space is. One of the reasons we designed our guides and our drills the way they are, the majority of implants that are placed are basically 4.3 or less. So we tried to keep the diameter of our hub and our hole in our guide, if you would, less than 4.5 so that we can tackle the majority. So are there cases where you need a bigger hole? Yes, there are. But we're trying to simplify and really make these cases super simple, super easy, so that you're not having to buy multiple. Some kids have, one set of drills for 3.5 or less, and one set of drills for 4.3 or less, and one set of drills for 4.3 or more. And so it adds cost, it creates complexity, and so we're trying to simplify this thing a lot. So as you can see here, with a drill extender, man, we took a case that you would have had to buy a separate set of drills to keep it to a small diameter, but because we didn't overextend our guided system, we dropped this thing in here in a spot that's pretty tight. So we drilled the hole. We had a little bone bleeder, so I probed to check and make sure that everything was fine. Everything was fine, and so we just dropped the implant in, hand tightened, And this video is actually in fast forward mode, so I do not crank implants quite this fast. I like to slow and steady, but I didn't want to bore you watching this. And so you can see real quick, we're letting that implant do the work at the apical 1.5 millimeters. So there it was. We were starting to torque out. We stopped. We put the guide on because we have a reference on our guide. So you can see there, we're already at 40, 45. So we're going to slowly use this implant to expand. And once we know by the mark on our implant carrier that we're to depth, we're going to just correct our timing, make sure we have one of our hexes on the facial. And once we have that, we're going to take this off. We're going to quickly take a look with our probe, just feel around, make sure that everything's good to go. And then we know that our bone was not level. We're higher on the mesial than the distal. And so we're going to have to do something about that. We're going to take a bone profiler. This is the first time I've ever actually used this bone profiler, and I was very impressed. I've only used rotary driven bone profilers. This one's from Glidewell. It's a hand driven, so the two little conical portions at the end fit in the implant itself, and then you can see kind of we have teeth that will act as a rake, if you would, and so they'll clear the profile. And you'll see an x-ray here in a minute. Before I profiled, I had a prefabricated temp that I put on there, and it wouldn't seat. And so we come back in and we put the profiler on, and so you really can't see what's going on here, but I just got one finger holding that profiler in the apical direction, if you would, and we're just rotating this thing around, and you could actually feel it grabbing those little bone threads. And here in a second, you'll see when we take this thing out, that thing was actually very atraumatically kind of scraping away the bone. And so we cleared away some bone. We took a spoon here in a second. You'll see I just kind of smoothed up and made sure everything was looking good. And after the fact, so we were able to get the temporary to seat. I came in a little bit just to ensure we had some more room. I came in with a slow speed on the mesial, and you'll see this. This is what it looked like when I tried to seat my temp crown. And obviously it's not seated, so yeah, we're going to need to do some work. The angle of the x-ray is a little cuckoo. Obviously you can tell it's coming from over on top of the canine. So the angulation is a little deceiving, but there you go. After we did a profiler, it seated no problem. I came back in and smoothed up that bone on the mesial wall with just a slow speed, 6 or 8, and just kind of, so I freed up a little bit more room. And so we were able to get our immediate temp to seat. I'll be honest with you, I was not expecting to have enough bone to do an immediate temp. So when I generated this from Blue Sky Bio's software, I made a model that just gave me a tie base replica, if you would. And so we milled the crown with no opposing. I did not scan as lower because I really didn't anticipate that. So we dropped it in, did a few adjustments, plugged the hole, and man, we're off and running. So anyways, if you have any questions or comments, so come check out PilotPlus Dental. Our website just kind of shows off our cases, kind of tells you what we're doing. Premier 3D Labs is the website you can go to see how we make our guides and kind of how the process works. We not only make your guides, but we're there to hold your hand, help you, especially if you're a beginner. We want to help you get into the game and safely, predictably place implants and knock things out of the park like this. We want to help you make these cases super simple, super easy predictable, cost effective, and keep your patients happy. So anyways, thanks for watching. Appreciate you. Blessings.